All right, everybody. Thank you for coming tonight to learn more about all the local programs around New York and beyond, as well as learning about Burke Rehabilitation Hospital. Burke Rehab Hospital, it was founded in 1915, but our residency programs in PM&R started in 2016. We're a standalone rehab center with 150 beds comprising five different units: cardiopulmonary, ortho amputee, spinal cord injury, traumatic brain injury, and stroke. We have a lot of different practices throughout the hospital, including neuropsychology services, music therapy, canine therapy, as well as a lot of different consultants that come through the hospital, such as medicine, cardiology, podiatry, and other rehab services. Next slide. We're located in White Plains, New York. It's the 11th largest city in New York, home to a large shopping mall, a lot of different foods, activities, a robust downtown area. We have easy access to the city. We're about 30-40 minute drive from Manhattan, but also can take the Metro North into the city. It's kind of like being in the best of both worlds where we have easy access to the city. My friends and co-residents and I visit the city often throughout our time as residents at Burke, but also have access to upstate New York to see the beautiful sights and go on some hikes. Next slide. Going from that, we are a program that really focuses a lot on wellness. We do a lot of wellness events, both official and unofficial, throughout the years, during our time here at Burke. It's really nice. We're a really supportive community that takes the time to really get to know each other, from the co-residents to our faculty members. Here at Burke, being a standalone hospital, we are the only residents. So in a sense, we are the resident body. So everyone gets to know everybody really well, from the folks in the cafeteria to the janitorial staff to the CEO, who I was just playing a game of horse with on our basketball court outside. He won, unfortunately, but it's a really special thing to be able to get to know your CEO, your chief medical officer, and just everybody around you, sort of feel like a real family here over here at Burke. Next slide. Here we have our leadership and faculty. Dr. Chaudhary has been our program director, and Dr. Mullab Shah is our associate program director, as well as our director of ortho and amputee. We're led by Dr. Muyan Opark, our chief medical officer, who is really an invaluable resource within the world of PM&R. She is absolutely outstanding and a true master of pretty much everything you could think of in physiatry, and we're really honored that she spends the time with us, both in the clinic setting and on the inpatient settings, teaching us. Again, it's a really rare experience for anyone to be able to sort of know their chief medical officer within an institution. So the fact that we get one-on-one teaching from such an individual at Burke is really amazing. She really helps sort of whip us up into being really amazing physiatrists that our patients are really proud of, and are we're able to really provide excellent care through her teaching as well as the other attendings here at Burke. Next slide. So we have currently have 8 residents per class, but we're going to be expanding to be accommodating 9 residents per class through Dr. Chaudhary's leadership, starting with our incoming class. And we also have sports medicine and brain injury fellowships here, both taking 2 fellows per class. That provides a really great foundation by having a large residency class for us to support each other, learn from each other. We all come from different backgrounds, different areas of the countries, MD, DO. It really breeds a lot of interclass learning. As well as it's great that we have the fellows here who can provide extra teaching, education, the sports medicine fellows to walk us through an ultrasound course curriculum every year, and we get a lot of teaching from the brain injury fellowships and a lot of leadership from them on the floors. Next slide. We have a couple different rotation sites here at Burke. We have Burke's main campus where we do our inpatient physiatry, as well as a lot of our outpatient work. It's been described something akin to looking like a country club. We're really proud of it. It's really beautiful here. There's flowers, grass, scenic areas. It's gated. We're really proud of our grounds here, and we feel like it sort of breeds uh, rehabilitation in the air when everything around us is really calm and beautiful and peaceful. But we also are able to go and learn over at White Plains Hospital. We have ONS Sports, which is a private practice group who we do sports medicine with, as well as some elective time with. We also go down to the Bronx, where we work with our Montefiore folks to get sort of a different patient population and get more of an inner city experience, as well as at Jacobi Medical Center. And then we do our pediatrics at Seton Children's Hospital, which has a pediatrics clinic, a rehab facility, aquatherapy, as well as its own special education needs children's school. So we get a lot of really diverse pediatric experience during our time here too. Next slide. Our call schedule. So our PGY2s take on 2 to 3 days per month, more so on the weekends, either covering a Friday, a Saturday, or a Sunday. As a PGY3, again, it's 2 to 3 calls per week, but they cover the weekdays. We don't do 24-hour shifts anymore. So on our weekends, those are 7 a.m. to 7 p.m. On Fridays, it's from 5 p.m. to 10 p.m. And Monday through Thursday, it's just 5 p.m. to 7 p.m. for the most part. And then as a PGY4, we take zero to no call, but on Saturdays now, where PGY threes and fours are able to moonlight here at Burke. So we're able to provide some extra funding for us from an educational standpoint, which is great. Next slide. We have 4 hours of didactics a week. It's truly protected time, meaning that we are not getting calls, we are not being asked to do other things. Our attendings are totally unplugged from us and managing our patients on the floor during our didactic time on Wednesday morning. They even write our progress notes for us for the day so we can truly, really be honed in and focused in on our learning. We kind of mix it up between doing more hands-on didactics, things like EMG practice, ultrasound, virtual models and virtual trainings, hands-on time with a therapist, learning how to do things from scan to navigate throughout the halls in a wheelchair to sort of get that experience for ourselves, as well as more formal lectures from things like our Cucurilla Boards book and our recap sessions. We also have monthly grand rounds on Fridays where we pull in speakers from across the country to sort of get a broader horizon of an experience. Once to twice a year, we also go to a cadaver course at Einstein School of Medicine where clinical anatomists lead us through sort of a pre-dissected cadaver so we could get sort of that second pass look at these muscles, nerves, and connective tissue now that we're residents. I think we have a much greater appreciation for all these things compared to when we were medical students back in the day doing it in our cadaver lab. Next slide. There are a lot of opportunities to get involved here at Burke from rotations and observerships. Um, we do a medical student fair yearly where we pull in medical schools from all across New York, where people come and tour Burke and learn about PM&R. We have adaptive sports through our sports program, everything from boating to bicycling. Uh, we have sports coverage and are working with local high schools to even further expand that. We're going to be helping out with things like sports physicals and attending more of their football games for more sideline coverage, along with the sports fellows, and have a lot of opportunities for research and leadership here. Next slide. This is a list of some of where our alumni have gone from a fellowship standpoint as well as private practice. I'm proud that a lot of my co-residents and I feel very diverse in terms of our career goals, from pain, sports, sport and spine, private practice, general, brain injury. A lot of our residents and fellows even stay on at Burke. This past year, a sports fellow and a traumatic brain injury fellow both took positions here at Burke. And one of my seniors is now one of my fellows here at Burke in the traumatic brain injury program, which is really great to see that people want to stick around and they want to stay at Burke and stay a part of our family and community. Next slide. Uh, we have a competitive salary here at Burke. The salary definitely covers what's needed to do well and be comfortable here in White Plains. They also have housing for us here at Burke. It's not guaranteed, but it's subsidized and comes pre-tax. So a lot of us, including myself, opt to be in the resident housing. It's kind of nice. It's got sort of a college dorm feel where we spend time with each other, both doing study sessions and having fun. A lot of game nights, pizza nights, gaming nights, mixed in with some studying and healthy good time. Uh, Burke provides memberships to the AAP and AAPM&R, as well as the New York Society of PM&R. We also get our food covered here at Burke. We have a beautiful cafeteria where we get $20 a day covered. Not having to think about paying for meals has been a really big benefit of being here at Burke. I remember being that starving, broke intern and having to think about food, and now I don't even think about it at all. It's a really amazing thing, and the food's actually really quite good. We also provide us with board books, study books. Right when we walk in, we're given PM&R recap, Cucurillo, Bradham's. So we really have everything available to us right away to sort of hit the ground running and start developing our physiatry skills. Next slide. Here's a picture of all of us at the medical student fair. For everybody from attendings to Dr. O'Park to our CEO stayed late on a weekday to help support this. I'll never forget our CEO handing out little tickets to the medical students to come in the room and join us. Again, it's sort of a really special experience to have our administration be so close with us and so close to the residents. I don't call him Mr. Ellerman, I call him Scott, and that's sometimes that's not my CEO. Again, that's my basketball rival. Burke is a really special and amazing place. If our residency corner coordinator is Maddie, who's absolutely incredible. Please reach out to her or me if you have any questions. My email's there, and follow us on Instagram, and we'll take any questions.
Thank you so much, Matt. Anyone has any questions, feel free, just to chime in. Also, I'll be reading questions in the chat whenever they come up.
Yeah, if it's okay, I did have a question about the adaptive sports opportunities.
Please.
All right. I was just curious how integrated into the rehab curriculum and patient care are these opportunities within adaptive sports in the area? And is it more something that we have to reach out on an individual level, or is it community based or kind of tied in through the hospital?
Yeah, I can answer that. So it's going to be most prevalent on your spinal cord injury rotation. We have a spinal cord unit. That's the majority of the patients that participate, as well as when you're in the outpatient clinic with Dr. Newman, who's our sports fellowship program director. It's not a requirement to participate in any of the adaptive sports, but it's great when residents do come. Uh, it's usually either on weekends or evenings. Things like adaptive bowling, golf, tennis are pretty regular events. And then there's big things like sailing in the Hudson, surfing out on Long Island, all different stuff. And then separate from like the medical side of it, our rec therapy department coordinates all these events and helps run it. So we just serve as kind of support and any sort of volunteering, filling in gaps where we need to.
Okay, Devanshi, I'm sorry if I mispronounced your name, but she asked, are there opportunities to do more niche electives like cardiopulmonary rehab or even global outreach electives?
Yeah. So not even opportunities, requirements. I guess we have a cardiopulmonary rotation. So Burke has 5 rehab units of 30 beds each. So as a PGY2, you do one rotation on each one, cardiopulm, spinal cord, brain injury, stroke, and orthopedic/amputee. And then for global outreach electives, essentially, if you can plan it and get it approved and get all the paperwork done, it's fine. Residents have done it in the past. It's a lot of paperwork, but if you get it done, yeah, you can do it.
Thank you, Dr. Chowdhury. Addison asked, good evening, Dr. Slitsky. Because Burke functions as a standalone rehab hospital, how does the influence, how does that influence the mentorship model between residency and attendings? How's their experience?
So I think it's a really powerful and positive thing that we're a standalone. It really kind of puts the onus on the residents and the physiatry attendings. We have internal medicine support, but they're as consultants. So it really kind of pushes you to think creatively, to manage your own patients, to work with your attendings. It inspires a really close relationship with your attendings because that's who you're working with to help try to make the patients better and to try to improve their quality of life. Um, I think it's great that I came to a place like this that is a standalone. Again, just because it puts the onus on you, and that's what you want as a trainee in medicine. You want that responsibility with plenty of oversight so that you can learn how to be confident, learn how to manage your patients, and learn how to manage complex situations. And I feel like I've had the breathing room to be able to do that, be able to grow myself as a doctor while still having plenty of great attendings like Dr. Chaudhary, making sure I don't go too crazy with it.
Thank you, Matt. We have two questions about research. They're essentially asking, how involved are residents in research, and are there protected time for research time?
So there's plenty of different ways to get involved with research, both at Burke and with Montefiore. I'm really proud that I've been able to stay pretty consistently involved with research and get a handful of publications out there with me and my friends, write some book chapters, and stay involved. There's both brain injury research going on here through with some post-stroke intervention type research. We're doing research in spasticity and a lot of other rehab sort of managements. And Burke is really supportive of us going out and meeting with attendings at pretty much any institution or working with fellows at Montefiore to get to do research with them. Um, I recently did a presentation at a pain conference through working with Montefiore's pain fellowship director, where I was able to do a presentation for attendings and pain fellows. So there's a lot of different opportunities to get involved in research here with the Burke residents, the Burke attendings, and really sort of grow yourself in your scholarly activity in your work. Dr. Chaudhary is also very supportive of us going to conferences, as long as submitting case reports so we can get sort of an expanded learning and education at these conferences too. We have $1,500 conference budget, which thankfully also goes a long way in helping us get to these places.
Yeah, I'll add we have a research coordinator for supporting the residency program. So she helps with submitting for IRBs, planning out whatever case series, systematic review, meta-analysis. She will get you library access. We have access to the Einstein College of Medicine resources for research. And then we have a Burke Neurological Institute on campus as well, which is doing many randomized control trials. If the motivation is there, you can connect there as well to do further research.
Thank you, Matt. Thank you, Dr. Chaudhary. So for the sake of time, we're going to take about two more questions. Megan asked, um, she said she would love to hear more about the PEDS exposure during residency.
Sure. So I'm actually on the pediatrics rotation right now for my second month go around, and it's a really great experience. So we work at Seton Children's Hospital. It's both a pediatrics clinic for physiatry. It is a special education needs children's school, as well as a rehab center for children that has PT, OT, speech. It has a pool for aquatherapy. It has feeding therapy, which is also a really unique thing that not every rehab center has, even amongst pediatric rehab centers. There's a handful of different attendings we can work with, but by far our favorite attending to work with is Dr. Peachy. She's 87 and has been at Seton Children's working actively there for more than 50 years. So she's just a wealth and fund of knowledge that is really invaluable. She has quite literally seen and done it all when it comes to peds rehab. We're also really proud one of our Burke alumni just finished her pediatrics fellowship at Montefiore and is joining with Dr. Peachy in the Seton's group. So she started this week, Dr. Yu. So it's pretty amazing being able to work beside Dr. Peachy and her greater than 50 years experience while also learning with Dr. Yu, who's this was her first week as an attending.
Thank you, Matt. And then last question for today, not for today, for this session. So Francesca asked, can you touch more on your rehab opportunities at Burke, and then any experiences with doing integrated rotations at Montefiore?
Yeah, so I guess we have three neuro rehab specific inpatient units: our stroke unit, brain injury unit, spinal cord unit. And really, there is on top of that a lot of neuromuscular and complex neuro cases. In the outpatient setting, an extensive amount of like brain injury, spasticity management, concussion management. You spend time in spinal cord injury outpatient. We do away rotations at Jacobi, which is the big trauma center for the Bronx. So you're seeing a lot of acute neuro pathology over there. And then I guess that goes over towards like the integration with the Montefiore health system. So Burke is part of the Montefiore health system. We are the PM&R in Westchester County, and then the Montefiore residency is for Bronx County. Residents go between both. We always have three Montefiore residents with us. They always have three of ours down there doing outpatient. So our residents get good training in a different setting, learning different hospital settings, from different attendings. They get to spend time with the Montefiore Pain Fellowship. They spend time with the Sports Fellowship attendings, along with like other well-known attendings down there. And then at the same time, their residents are with us getting like high-level inpatient rehab exposure. So it's a very cordial and collaborative relationship.
Thank you, Dr. Chaudhry. Okay, so thank you both, Matt, Dr. Chaudhry. We're out of time, but thank you so much for taking the time to speak with us today. We really, really appreciate it.
Yeah, I'll say
And
thank you guys for having us and good luck to everyone. I know it's tough,
mm,
but look forward to calling you all our colleagues very soon. And you can always email me if you have any questions or need any help.
Absolutely. I'm going to drop my email in the chat too, and I hope to see some of you guys at our upcoming medical student fair. Have a great night, guys.
thank you.